welcome to this fellowship program. Today we will be covering the module of advanced histopathology in cancer diagnosis. Before starting, a little bit introduction about me. This is Dr. Arya Sharma, MBBS MD Pathology. I'm currently working as a pathology faculty at Bridgetown International University, North America, and I have around 5+ years of experience in teaching. So let's start. Now, the very first thing is the definition. What is a neoplasm? So, neoplasm is basically a abnormal mass or a tissue, right? The term is only saying neo. What is neo? Neo means something is new, right? New means something is new. So, what new? This new is abnormal mass tissue and the growth which exceeds in uncontrolled or uncoordinated environment with the normal tissues. Like you have the normal tissues, right? If the tissues or the cells are growing in an unrecognized pattern or an uncoordinated pattern, so that will be the cancerous cells, right? The neoplasm is defined as a mass of tissue formed as a result of abnormal, excessive, and uncoordinated, autonomous, and purposeless proliferation of the cells. This is the proper definition of neoplasm, which you should know, right? Now, how a normal cell converts into a cancerous cell. You have certain cell phases, right? Like the interphase, prophase, metaphase, anaphase, telophase. Then the cell goes into the differentiation, and after that, there will be damage of the cell, which will be converted into the cancerous cells, right? Now, you need to know about the cellular proliferation. Like you have the intracellular mechanism of control, like the growth fraction, cell cycle time, and the cell, how many amount of cells or how many number of cells are lost. Neoplastic cell population, ignore this normal growth of the cells. Then you have the cell membrane and growth control mechanism. How the mechanism or how the cell membrane acts when there is a new growth. So, appropriate cell recognition by membrane enzymes and the surface sugars. Like you have read in your 11th or 12th when you were taking biology, you have something called as the cell membrane, right? In that cell membrane, you have certain enzymes and you have certain sugar molecules. Then you have the cellular adhesion. What is adhesion? Adhesion means sticking to something, right? Desmosomes, tight junction, gap junction, and electrical charges. Then you have the intracellular communication. Intracellular means within the cell. Growth stimulators and growth inhibitors. Now, missing or abnormal glycolipids or the glycoproteins. They decrease in the number of desmosomes, tight junction, gap junction, and more negatively electrically charged. There is a lack of response of growth stimulators and growth inhibitors in them. Now you have the cellular differentiation. The cell can be very well differentiated. If they are very well differentiated, you will call them as benign. Then they can be poorly differentiated, and undifferentiated ones are called as your anaplasia. Okay, undifferentiated one is called as your anaplasia. Now, next thing what you need to know are the categories of tumor. This, guys, is very, very important table. And being a pathologist, you should be very thorough with this table. Like you have the mixed tumors. In this, you have the adenosquamous carcinoma and collision tumors. Then you have the teratomes, like the benign or the mature. Benign one in the ovary teratomes and the malignant one in the testicular teratomes. This one is the example. Then you have the blastomas like nephroblastoma and hepatoblastoma related to your kidney and related to your
Cancer diagnosis starts with microscopic precision. Histopathology remains the gold standard in cancer detection. Advanced techniques improve diagnostic accuracy and clarity. IHC helps identify specific tumor markers. Digital and molecular pathology reveal hidden details. These methods enable early and precise cancer classification. Accurate diagnosis guides personalized treatment decisions. It helps predict prognosis and disease progression. empowering clinicians with confident diagnoses. Advanced histopathology, saving lives through precision.